Hi, it's Dr. Harris at California Hernia Specialists. I wanted to put together this short introductory video to talk a little bit about complicated hernia repairs, whether that be an inguinal hernia repair or some of the more difficult ventral or incisional hernias that we see. Starting with the inguinal hernias, unfortunately some patients have lived with their hernias for sometimes 20 and 30 years, which over time, as that hernia gets bigger, allows all of the intestines to drop out of the abdominal cavity and into usually a large inguinal hernia, or what we call a large scrotal hernia. So as you'll see in some of the pictures below, these are some patients who have lived with their hernias for so long that it's now almost basketball sized shape of their hernia and size of their hernia. So those are a challenge. One, getting the intestine back into the abdomen can be a challenge. And two, the bigger problem that we have is that after that hernia is back in into its normal environment, after those intestines are back into the abdomen, that scrotum is still left as the size of a basketball, and it can take months for it to shrink down. And unfortunately, during that time, fluid collections can form, and sometimes blood collections can form inside that scrotum, which can lead to hematomas or seromas. So that's one of the things that we caution patients and counsel patients against when we see them in the office with large scrotal hernias. The second type of large complicated hernia are the large incisional hernias. Patients who have had numerous operations from either trauma or previous colon surgeries or gallbladder surgeries and now have large hernias. Often we get a CAT scan, which can sometimes demonstrate what we call a diastasis of the rectus muscle. So not only is there a hole in the muscle, but the muscle is actually pulled apart, and then there's now a weakening in between. So some of these complicated patients, I actually bring in a second surgeon who's experienced in doing complicated abdominal hernia repairs. And we sometimes will actually bring those muscles together, sort of like a tummy tuck type of procedure, where we're reinforcing those muscles, bringing the rectus muscles back together, but we're also repairing that hole in the muscle. We also put in a mesh at the same time to reinforce that and to strengthen that muscle. But hopefully some of these pictures that you see below will help explain and walk you through some of the more complicated surgeries that we do. As always, if there's any questions or concerns that you have, certainly give our office a call. We're always happy to help and discuss your particular case with you in the office. Thanks.